Hello everybody. Today we are going to discuss about the injections and how painful are they in an IVF cycle. The most common question we get whenever there is an inquiry for an IVF cycle or a couple is about to start their treatment is how painful are these injections. Now these injections, what type of injections do we use? There are different type of injections used in an IVF cycle. Under the broader umbrella, there are stimulants and there are inhibitory injections. The stimulating injections are used for controlled ovarian stimulation, where we give them with the aim to develop as many follicles in that particular stimulation cycle. They are usually started on day 2, day 3 of your periods when a short protocol is utilized for your stimulation, or if the protocol is a long protocol, then prior to your period there are some injections, and these gonadotropins are still started on day 2, day 3. Gonadotropins come in two varieties. One are prefilled syringes, where this is how the syringe looks. The dose is already filled, the dose is already set, and you just have to twist and open the needle. This is how big the needle length is. It goes only and only into the skin, and you are supposed to take these injections, prefilled syringes, all by yourself, or a nurse can help you. Another variety of gonadotropins, they come in prefilled vials that the nurse will make, prepare and give it to you, but these are the needles that come with them. Now these syringes are already calibrated with the doses, as you can see. Depending on what dose has been already given to you by your doctor, you are supposed to fill them. Let's say your doctor has given you a dose of 300 units. So you can see this line in front of 300 units, right? You are supposed to first twist open. Again, look at the needle. It is such a small and a thin needle, it does not cross the skin. So these injections are meant for subcutaneous use on the tummy or on the thighs. Then you are supposed to attach the vial on top and very slowly fill this needle up to the 300 mark that has been given, or up to 375 mark. Once you have filled it up to the 375 mark, you are supposed to hold the body of the needle and pull it out. Now try not to push the plunger at any level. You might end up pushing the plunger prematurely and leaking of the dose that is advised for you. You have already filled the syringe up to the prescribed dose. Now you are supposed to hold the body of the syringe, and 90 degrees this needle is to be pricked into the tummy or thighs. The lower part of the tummy below the navel, or thighs, wherever you are comfortable. Once you have pricked the needle 90 degrees, change hands, hold the body of the syringe with another hand and use your dominant hand to press the dose. So these are calibrated syringes, but they are not pre-filled. Sometimes these are given with the injections prescribed to you, and sometimes pre-filled syringes are given where you don't have to adjust any dose, you can directly take them. This was about the gonadotropins. Now coming to the next injections, which are inhibitors. The job of these injections is to make sure the stimulated follicles after a particular size do not rupture prematurely. We do not want your ovarian follicles to rupture within the body. We want to retrieve the oocytes that are maturing inside these follicles, and for that particular reason we have to wait till these follicles reach 18 mm or above. So now what do? We add a few injections which will inhibit the premature rupture of these developing follicles because of gonadotropins that you've already been taking. There are two kinds of protocols, Antagonist and Agonist. Depending on which protocol your doctor has given you, these inhibitory injections will be added. Antagonist protocol is the most widely used protocol, short protocol. In this, inhibitor injection is given to you either on the 6th or 7th day of your injection days, or once the follicle size crosses 14 mm or is reaching up to 14 mm. Now these inhibitor injections, they come in pre-filled syringes like this. So yes, the dose is already set and everything is in place. Again, you have to twist, open, see how thick. It's a very thin needle and a small needle again because it is meant for your subcutaneous use. You're supposed to hold the body of the syringe, okay, not the plunger. You might prematurely push it and there will be leaking of the dose. You're supposed to inject it 90 degrees, tummy or thighs. Change hands, hold the body over there once it's already inside the tummy or thigh, and with the dominant hand press the plunger. So here this is an inhibitory injection, which is given antagonist injection, which is given in short protocol or antagonist cycles. Another protocol is long agonist protocol, where a few injections are given before you get your periods. Now these injections are given with a dual purpose. First is to maximize the cohort selection of the follicles before periods begin, and after you get your periods and we put you on gonadotropins from day 2, day 3. The job of these injections is to prevent premature rupture of these growing follicles. Now in that case, you might have to use a tuberculin syringe. So this syringe, total syringe is 1 ml. So the markings are 0.1, 0.2, 0.3 and 0.4. This is also meant for subcutaneous use. If you open and see, the needle is again of subcutaneous use, very thin and very tiny, does not cross the skin. These injections will probably start from day 21, 22 of your previous period. Once you get your periods, day 2, day 3, you have to visit your doctor. They would adjust the dose and add gonadotropins in that cycle. So to answer your question, are these injections very painful? No, they are not. These injections are necessary for our IVF cycles. They have been over the years made into more patient-friendly use with the needles becoming thinner and subcutaneous uses, more patient-friendly in forms of prefilled syringes, or your doctors or your clinic will also provide trained nurses to help you with your shots. We have already attached a link below, the tips and tricks that you could use to take your injections. You can visit that link to know a few tips and tricks before you are about to take your injections. Thank you so much.